My name is Mokasa Apollo. I work with Uganda National Action on Physical Disability. In short, people know us more as UNAPID, and I work as Executive Director. I'm glad to have you here in my office. I'll give you a brief about what UNAPID is. For those of you who are in UNAPID for the first time, UNAPID is a non-governmental organization for persons with physical disabilities. It's a membership organization whereby our identities are mostly persons with physical disabilities. Like other DPOs, like all disabled person organizations, we work towards ensuring that the rights of persons with disabilities is respected, so that this individual person with disability lives lives of dignity, independent life, and enjoys his right to access to services like access to inclusive education, access to inclusive health, access to physical environment through ensuring the physical accessibility of public structures, enjoying his right to participate in disability sports, among others. The organizations as structures, which you call associations of UNAPID, in the 38 districts of the country, and out of the 38, UNAPID is visible in terms of projects in over 12 districts. We have active or running projects in over 12 districts, of course, depending or implementing different interventions of the rights of persons with disability, like education, health, as I mentioned. The organization, this is where we're situated. We're on Gayaza Road, along Kanya. This is where offices are. But of course, we base from here to reach out to our individual members on the ground in different districts. That's briefly about UNAPID, and we are governed by the board of directors and have a secretariat of around 16 staff members.
So what are the challenges that you face
The organization, or UNAPID in particular, as all of us we know, during the COVID-19 era, which hit our country in, I think, slightly beginning in March this year, like other countries around the world, were equally affected in terms of the day running of activities. When Uganda, or when the president of Uganda declared the lockdown of the country due to COVID-19 pandemic, I think around the first week of March, as other organizations, equally our organizations was so much affected in terms of running of its activities. Most of you, or all of us, as we know that the NGO work is mostly concerned with reaching out to the vulnerable populations who are mostly based in the rural areas. So reaching out to those people means that you need to move from Kampala to go down there, you engage them into meetings, you engage the local government stakeholders, you do a lot of interactions and gathering and discussing, translating concepts and issues. So, but when the country underwent a lockdown, that's banning of public transport, banning of gatherings, banning of movements, meant that even the work of the organization like us was also equally affected. We could no longer reach out to our members. We could no longer implement ongoing projects which we are basically targeting empowering individual persons with disabilities in the local area. We could no longer gather them into a group to discuss concepts. We could no longer move down to engage the policymakers. Our work was paralyzed by the lockdown, like any other civil society organization or even the government agency. So our work was paralyzed so much, and all of us were confined in our homes, as all of us we know, and we felt it, but not so much us, but most our members felt it. The persons with disabilities felt it so much because they could no longer get our services close to them like it used to be. That's how bad it was in the lockdown.
So how have you coped up?
Yeah, but during the lockdown, much as work was paralyzed, as all of us we know, but UNAPID did not sit aside to wait until when the government probably will declare the country a lockdown free. UNAPID, within our own homes of individual staff, we've virtually been engaging ourselves, the different staff, into a number of activities which are aimed at sensitizing or enabling that this individual person with disabilities who is out there in the local area gets access to relevant information about COVID-19 prevention, COVID-19 management, measures of Ministry of Education, rather measures of Ministry of Health, on how to prevent COVID-19 pandemic so that they are not so much affected by the virus. UNAPID is known so much of using the power of social media. We used our website page. We used our Facebook pages. We have used our different electronic mediums of communication to design and send out as much information as possible to our individual members who are down there at the grassroots to be able to get to know what is really this COVID-19 virus. How do you prevent it? How do you manage it? Who is more vulnerable? These messages have been designed in a very accessible way to those members who are able to use a smartphone, who are able to go to and access an online message, so that they are not left behind so much in the COVID-19 era, so that their vulnerability is somewhat reduced. You also use a lot of communication through phone calls to talk to members, talk to people, reach out to them, those who are stressed, those who are really very vulnerable situations, to give them counseling, to advise them, to give them those comforting messages, to give them how do you prevent the COVID-19 through talking to them on our phones so that they feel they are with us despite the fact that we are not physically together in several ways or the other. But also work with other civil society organizations, our fellow DPOs, to ensure that even when the government is addressing or trying to intensify its campaign on different messages of COVID-19 prevention, management, and measures of how to prevent the also peace, most of the time at first government used not to be aware that these messages also should be received to persons with disability, especially those who are blind, who cannot see, and those who are deaf, who cannot hear. So we've tried to work with government to ensure these press conferences where updates on COVID-19 are made, where the Ministry of Health, the chain could make updates, could make communications, where the President could make state addresses. These forms of communications are also coupled with a sign language interpreter so that people who are deaf, who cannot hear, who depend on more on sign language to get the message being passed on, they're not left behind, so that they also get access to that information and they don't fall prey of the infections of COVID-19. So we have been busy in one or the other, working from homes, working from our distances, but try to be part of the process of raising awareness about the COVID-19 prevention and the COVID-19 management, and encouraging our members to respect the preventive measures of COVID-19 virus.
Then your last message to the government first.
I appeal to government. First, I would like to make it very clear that persons with disabilities in this lockdown on the COVID-19, they have been adversely affected. Most of persons with disabilities, they depend on hand-to-mouth of survival. These are people who depend on small scale businesses who work for a day, who work for a day, don't depend on monthly salaries. You found them in trading centers, in urban areas, working in small informal sector. The lockdown, the ban on transport, the ban on public transport, the ban on movement has really mostly affected also the person with disabilities businesses. Most of them have gone to zero. They can hardly move using border because border borders were banned. They can hardly manage their businesses because the lockdown has really paralyzed everything. Most of them can hardly actually access healthcare services because most of them use borders to go through centers. They cannot move long distances. Taxis were banned. They have really been affected so much, one or the other, because of their vulnerability. So what I can urge to government, first of all, is to try as the government designs mechanisms to respond to COVID-19 era. Let the government be aware that among the people they're planning for, the budgeting for, they should also budget for persons with disabilities. Let the government involve us as DPOs. Let the government involve the leadership of disabled people's organizations and the leadership of persons with disabilities at different levels of the local governments. But the interests of persons with disabilities are part and parcel of the planning, the budgeting, and implementation. Let the government involve the people concerned, that their voices are not left behind. But also, I want to urge the persons with disabilities themselves. As you always say, stand out so that your voices are heard. Don't sit on yourselves. Don't be silent. Don't be silenced by anybody. This is an era whereby we need to fight for ourselves. Let your voices be heard in different forums, so that when people are planning, when people are budgeting, make sure that our issues of personal disabilities are included into those budgets, into the programs, and to the service delivery, so that we are part and parcel of the process. COVID-19 is here today. It's not going to go tomorrow. It was easier for you to come, but it's going to take time for it to go. So let's work together in the efforts of working to ensure that persons with disability are not left behind in the COVID-19 era. But even the development partners who are giving funds, who are funding COVID-19 programs, let them make it a condition that whoever is implementing COVID-19 response plan, they should give priority to persons with disabilities, because we are more vulnerable than anybody else. I thank you all.